Right, today I'm going to be talking to you about pediatric motility, and I'm going to be focusing my talk more on intraduodenal and colonic motilities. And although I know there's some medical professionals here in the audience, I will be talking, focusing my talk more towards the patients and families here in the audience today. Just to give you a historical perspective, the first pediatric GI motility studies were started around 1984 with a physician named Dr. Paul Hyman and his nurse at Harbor, UCLA. They started doing intraduodenal motilities, and their patients were observed and their data was recorded several days at a time. Dr. Hyman and his nurse would alternate 12-hour shifts so they would not miss any details. The motility pre-call is a very important part of motility testing. It needs to be done at least a week prior to testing, and during the pre-call, it's very important to not only explain what test is being done to the patient, but you need to review preparation for the testing, including did the patient need to fast before the test and how long they should fast. Also review which medications needs to be held or taken. For colonic motility or rectal motility, it's important to review bowel cleanouts. And for testing such as intraduodenal, it's important to explain things like they need to withhold prokinetics for 48 hours prior to testing. You need to explain testing in simple terms. These motilities are not very well known, so patients are not really familiar with them, so you need to explain them in simple terms so they understand. It's also important to explain to patients any possible discomfort and possible complications that may be expected during this testing. For example, esophageal motilities and intraduodenal motilities, these catheters go down the nose and into the throat, and they may be a bit uncomfortable during the test. And also, where these motilities are not very common, you need to answer questions and concern and provide emotional support. There's several different types of GI motility testing. First, anorectal and esophageal are pretty common. Others that are not so well known are intraduodenal, colonic, sphincter of Oddi, ileal, and jejunal motilities. To get into a little bit more detail, anorectal motilities is also known as ARM. This is the most common and most likely the fastest type of motility testing. It can usually be done in under 10 minutes. This is helpful in evaluating the function of the internal and external anal sphincters, which is also called the high pressure zone. It's also helpful in diagnosing the outlet causes of chronic refractory constipation or fecal incontinence.